you go into medicine, you go into surgery because you want to protect patients from their diseases, but you never imagine you have to protect these patients from the hospitals. And
or maybe even from their own parents in some cases.
Yeah, as a doctor, you have a responsibility to the patient, right? You took an oath and you have a responsibility for that. So, given that the biggest children's hospital in the world was lying to the public about the existence of their transgender program, I had a responsibility to do it. Any doctor has a responsibility to do that. And that's why, around January that time, 2023, I began to reach out to journalists because I saw what was happening. And, for a children's hospital to do this is a egregious violation of medical ethics, something that is unconscionable.
And what happened next? So, like, in that moment, like, how did your outreach to journalists turn into people hearing about it? Because when you Google this, you'll bring up in May, like, again, that Attorney General talking about investigating Texas Children's Hospital.
Yeah.
And maybe this is a good moment to say, so Marcella, at this point, are these things legal? Let's leave aside they said they aren't doing it anymore, and that there's fraud in doing a thing you say you're not doing. But was it legal to be doing this with kids as early as 11 years old?
So no, there's not a single state law that would allow for child abuse or that would allow for the mutilation of perfectly healthy children. And that's a big legal issue here in this case, that these things are not legal.
Now, you use two terms, child abuse and mutilation. They're pretty charged, so I want to really push into that. So, obviously, I think the parents and the people who advocate for this would say, well, no, that's not child abuse and it's not mutilation. This is gender-affirming care, or this is whatever term they think is appropriate. How should I understand that this procedure to inject these substances that lead to these changes in their body during this important time? How should I understand that to be mutilation or child abuse? Like, help me understand that from a legal perspective.
So legally, those are legally operative words. Every state has a child abuse statute, and those words would be defined by state law. So it's a state-by-state basis on whether or not something is child mutilation, whether something is child abuse, whether something's assault, whether there's battery. There could be medical negligence, medical malpractice, violations of ethics that have been infringed on. Other liability in the civil context would be the business fraud, your deceptive trade practices. You're selling one product but giving another. You're telling these children it's not permanent, that you're pausing puberty when actually these children will never, ever grow their anatomy to their completion. And Dr. Haim can give you all the technical words for that. But these boys will never, ever have the anatomy of a grown man, ever. And they're 11, and they're given these treatments, and also women. And so they'll be sterile for life and create all sorts of other physical problems. It harms their health otherwise, bones, blood pressure, heart, their endocrine system, all sorts of medical problems. It makes you a ward of the medical state, very lucrative for these hospitals. And so all of those could be legally challenged because of the situation you've put these children in, fraud. And so there's a lot of liability, and these doctors are facing liability. And a number of these patients have come out as detransitioners, and they're bringing these lawsuits, and they're winning them, and they're settling them. But, another thing we could talk about is, so if it's illegal, how is it happening?
Right, and I want to get to that. So like right after I understand what comes next. So you're like, this shouldn't be happening. I have a duty, Hippocratic oath. How you understand your responsibility as a doctor, as a caretaker, and you reach out to journalists. What comes next? What happens next?
Yeah, so months and months failed. Tried reaching out.
What kind of responses are you getting from people?
Mostly no response. And I mean,
are you sending people any kind of thing to say to suggest that what you're saying isn't just hearsay, or you're not just a crank?
I would try to give like a little background, like, hey, I'm a surgeon. I'm here at this hospital. This is happening.
Yeah.
There were
but no like documents or anything like that, or...
No.
Okay.
I mean, so I finally got a hold of Christopher Rufo in like mid-May, and it was someone who worked with his team, and we go through this process where he just verified who I was and that this was legit. And I didn't know this at the time, but a vote was being just the week after, like the week or two after.
Yeah.
The Texas Senate was voting on SB 14, which was going to be the law that was going to ban these interventions on children. And it's embarrassing because I had no idea what that was. I didn't even know it existed. Even though I mean, it just goes to show how separated you can be from like Texas politics. But we go through this verification process and just to make sure I am who I am. And he wanted to release a story because he knew it was the real thing. And it goes to show that like after so many of these other people had, just ignored the story. I mean, Rufo, he's a real deal. He's an amazing journalist because he knew this was something meaningful. So he picked it up, and then
this is sort of his beat. I mean, he's taken on these the gender related issues and other things, and and he's willing to take the slings and arrows for it. And
yeah. So the story comes out on May 16th and was showing definitively that the hospital was lying to the public about a program that was manipulating these kids, mutilating them, and then sterilizing them. And it comes out on the 16th. And, all over the news, all the big names take it. And then the very next day, the story does exactly what we hope it would do. So the conduct that we had exposed was voted to become illegal the very next day in a bill that was passed with bipartisan support. And we were told that because of our story coming out the day before, it had helped a couple of votes who were on the fence. And that's absolutely amazing because now, Texas can be protected from this type of practice.
If you like this clip, we've got more where that came from. Be sure to watch the full video and don't forget to subscribe to the channel so you won't miss our new videos as they come out each week.